get irreversibly enlarged, affecting the breathing, we are going to do turbinoplasty rather than turbinectomy in the past, and sometime for nasal polypectomy when there is associated nasal polyps. Can we just next slide, please? Okay, so I will just show you one case. This is 12 years old boy. He came with the snoring, choking, with hearing impairment of the last year. He has past medical history with he is on a growth hormone due to growth hormone deficiency. The past surgical history, he has adenotonsillectomy at the age of 3 years, and he has 3 times laryngotomy with grommet after that. So the last grommet done 2 years ago. He is on all the medication of allergy, antihistamine, leukotriene antagonist, and he is also allergic to house dust and he's on immunotherapy. The medication since 1 year, and the patient didn't get any response. The otitis media diffusion is still there. He has a hearing problem. He has a learning problem, and the breathing during sleep was worse. So I'll just show you the nasal endoscopy. Look this mass in the nasopharynx. This patient is supposed to have adenoidectomy, done by myself. When I go there, there's a huge mass in the nasopharynx, but here, this is the midline, there is nothing. So this is all a lymphoid tissue hypertrophy, not responding to all the medication. I gave him 2 courses of systemic steroid, but still, he didn't respond. And this one is the hypertrophy of the torus tubaris. So I think if we will not do something to remove this obstruction, will not have any effect. So I did for him laryngotomy with a grommet. I wanted to do a osteotomy tube balloon for him, but there is no even an orifice you can go through to the osteotomy tube. It's completely blocked. So we use the COBLATOR to remove this mass. It's very deep in the nasopharynx. This is the aid of the COBLATOR. It makes bloodless field. It's very precise. We are ablating all the tissues, and we could enter to the osteotomy tube and do the balloon. He got a very good response, dramatic response, but we need to continue the medication for the immunotherapy and the other medication. So I think some sort of surgical treatment is needed and tailored for the patient according to his condition. With the aid of these machines, the new machines, we could enter precisely and see what is there, and could even, before we could not remove anything from the torus tubaris. This is the part regulating the osteotomy tube because of the future complication. But nowadays, we can do it with the aid of these machines. This is 3 weeks after the surgery. This is some crustacean from the inferior turbinate reduction. And look here that the nasopharynx is completely open, and this is the osteotomy tube orifice here. So the breathing improved, the otitis media diffusion improved, but definitely he needs to continue medical treatment. This is a patient, this is an adult patient with chronic rhinosinusitis. I did for him first surgery, but at the same time, look, the adenoid, how it is big. But this is, we did a shaper for him, removal of the adenoid. So nowadays, with the aid of the scope and the new machines, we can do some surgeries we could not do before with less morbidity, less mortality. So the adenoid, we can do it by COBLATOR, by dissection, by shaver, according to the favor of the doctor, of the surgeon. So if you are not removing this part from the nasopharynx, I think there is no medication will help the patient, because this is, it's a hidden posterior part of the nose. You cannot see it unless you will use the scope. And whatever you will do for the patient, the bleeding will stay the same. So the surgical treatment sometimes is tailored according to the need of the patient. On the other hand, this is the same patient, actually. We did a turbinoplasty for her, sorry. This is a young lady. So turbinoplasty, it can be done by COBLATOR, by radiofrequency, by laser, and sometimes partial turbinectomy. In this area of the world in UAE, because we have a lot of allergens, we are tailoring our surgery with a less aggressive techniques to prevent complication with the turbinates, like the Rhinitis Zika and the crustacean. So this is just turbinoplasty, the turbinate reduced by radiofrequency as a simple procedure. Does take just 10 minutes, and it improves the airway, and at the same time with less side effect. All the parts of the turbinate are ablated by radiofrequency. The other case that I want to talk about, it's okay. This is the last one. So this is 14-year-old boy. He has a chronic rhinitis with snoring, sleeping disturbances, nasal blockage, runny nose. In the last 3 years, he had 2 surgeries. He had ADENOIDECTOMY, and at the same time, later on, he doesn't respond to medication, so they did for him turbinoplasty. But the problem that the patient is still complaining of nasal blockage, rhinitis problem, sleeping disturbances. His BMI is high, 33. He is using every 2 to 3 months long-acting steroid. And he got the last steroid 2 weeks before coming to me, and still have the same problem. So I'll just show you his nose after injection of the Propose, and he's using antihistamine singular nasal steroid. This is his Malampati, is 2 to 3. His tonsils are moderate in size, but look the nose. Severe rhinitis with all the medication that he had. And I think he has a cushion because I sent him to pediatric endocrine to check. I think he has some sort of hypoplasia of the adrenal because of the recurrent use of the long-acting steroid. But look the rhinitis here. The nose is completely blocked. This is the left side. So this boy, when we did that, he has all the symptoms of allergy. He has a family history of allergic rhinitis. We did a skin prick test for him and his mom. Both of them, they came very sensitive to house dust mite. So starting with him, allergic immunotherapy, sublingual immunotherapy. And we are just going to see the response because this is just 2 weeks ago. So what I need to say that surgical treatment is not the treatment for allergic rhinitis. It's an add-on to the treatment, but the most important is the evaluation and the immunotherapy with antihistamine. Thank you very much.